Welcome, everyone. If you've ever felt completely overwhelmed by the sheer number of pediatric allergy meds, the cough syrups, and all that complex dosing math that goes with them, well, you are in the exact right place. We're going to take all that confusion, organize it, and give you absolute clarity. By the end of this explainer, you're going to feel incredibly confident navigating pediatric antihistamines. So, let's clear our minds and get ready to master this essential medical toolkit together.
At first glance, the source material we're decoding today might seem like a chaotic wall of medical shorthand, numbers, and arrows. It's intense, right? But this single page is actually a highly organized roadmap. It covers the whole shebang, from foundational single-drug guardrails right up to complex combination syrups. Our goal today is to break this down piece by piece. We're going to extract the logic from this handwritten masterclass to make your understanding and ultimately your safe prescribing as easy as possible.
Here is our roadmap for today. 1. The Cetirizine family rules. 2. Adding Montelukast to the mix. 3. Classic Chlorpheniramine and Atarax. 4. The golden weight formula. And 5. Decoding combination cough syrups.
Section 1. The Cetirizine family rules. Establishing the crucial age guardrails.
So the absolutely crucial point here, and you'll want to note the serious red flag tone the original source uses, is the hard stop on age limits. Just think about how these two closely related drugs differ. For Cetirizine, the explicit instruction is to avoid it below 6 months of age. But for Levocetirizine, the guardrail is much wider. It must be strictly avoided under 2 years of age. This is the very first thing you need to check before calculating any doses. These aren't just mere suggestions, folks. These are the foundational safety rules for the Cetirizine family. Okay, so once you've cleared that 6-month safety hurdle, we can trace how the Cetirizine dosage carefully scales up as the child grows. From 6 months to 2 years, we stick to a simple 2.5 milligrams once a day. Then, in that middle 2 to 6 year bracket, we get some flexibility, either 2.5 milligrams twice a day or 5 milligrams once a day. Finally, once the child is over 6 years old, the dose steps up to a standard 5 to 10 milligrams, given orally once a day. It's a very logical stepping stone progression, based entirely on age. But now, things really change for Levocetirizine. Remember our guardrail, right? We don't even touch this drug until the child is 2 years old. But once they hit that 2 to 6 year bracket, we actually abandon the fixed age-based dosing we just discussed for Cetirizine. Instead, we have to use a specific weight-based formula, 0.125 milligrams per kilogram per day, given as a single dose. It actually isn't until they cross the 6-year mark that we return to a fixed dose of 2.5 milligrams, given either as a single or 2 split doses.
Section 2. Adding Montelukast to the mix. Bridging single drugs to combinations.
Here we have the beautifully simple age bracket dosing for Montelukast. Unlike the weight math we just did, this one is purely chronological. From 6 months up to 5 years, it's 4 milligrams. From 6 to 14 years, it steps up to 5 milligrams. And for those 15 and older, it's a 10 milligram dose. But there's an HS notation tied to every single dose here. That means ora somni, or at bedtime. Consistency is key. The dosage changes with age for sure, but the bedtime administration stays exactly the same across the board.
Now let's see how this all builds into real-world pharmacy products. Let's deconstruct the formula for MonteL LC Kid so you know exactly what a 5 milliliter dose provides to the patient. Based on our source notes, a 5 milliliter dose gives you exactly 4 milligrams of Montelukast and 2.5 milligrams of Levocetirizine. Do you see how perfectly that aligns with what we just learned? The 4 milligram Montelukast is the standard dose for kids under 6, and the 2.5 milligram Levocetirizine is the standard fixed dose for older kids. It literally takes 2 distinct drug profiles and cleanly merges them into one 5 milliliter spoon.
Section 3. Classic Chlorpheniramine and Atarax. Traditional dosing structures.
Let's break down the dosing for Chlorpheniramine maleate. The overarching rule here is 0.35 milligrams per kilogram per day divided into 4 to 6 hourly doses. But the source notes kindly give us quick, fixed doses based precisely on the child's age bracket, which is a real time saver. 1 to 6 years gets 1 milligram. 6 to 12 years gets 2 milligrams, and over 12 years gets 4 milligrams. All of these are administered on that strict 4 to 6 hourly schedule. It's rhythmic and it's highly structured.
Then we have Atarax, also known as hydroxyzine hydrochloride. Now for Atarax, we don't have those neat little age brackets. We have to rely on a strict weight-based formula of 2 milligrams per kilogram per day.
And just like chlorpheniramine, timing is absolutely everything. It's administered every 6 hours. Sure, this requires a bit more math on the prescriber's part, but it ensures a precise, tailored dose for the patient throughout a full 24-hour cycle.
Section 4. The Golden Weight Formula. Unlocking syrup dosages.
Okay, get ready for this. The number 4. This is the magic number. The source material highlights a highly practical trick. Weight divided by 4. This simple equation gives you the exact milliliter dose for TDS, meaning 3 times a day. This is a massive time saver for prescribing popular syrups like Cherikov, Maxtra, and Allergy Jr. You just take the child's weight in kilograms, divide it by 4, and boom, you instantly have the milliliter volume they need per dose 3 times a day. It is elegant, fast, and incredibly safe.
But what happens if you don't have the exact weight handy? Well, our source provides standard volume fallbacks for these syrups based on common age groups. If the child is 1 to 3 years old, the fallback is 2.5 milliliters 3 times a day. If they're 3 to 5 years old, you step it up to 5 milliliters. Now, the weight math is always your best, most accurate bet, but these age-based volumes act as a really solid safety net when you need to make a quick, standard clinical decision.
Section 5. Decoding combination cough syrups. The combination flowchart.
By breaking down the brand name Maxtra into its 2 core components, we completely demystify the whole thing. If we trace the steps from the source, Maxtra is simply a combination of phenylephrine and chlorpheniramine malleate, which we just learned all about, right? So it's not some mystery liquid, it's simply a decongestant paired with a classic 4 to 6 hourly antihistamine. That's the entire foundation of the syrup.
Now, see how adding just a third ingredient instantly creates 2 entirely new formulas? If you take that base of phenylephrine and chlorpheniramine malleate and simply add dextromethorphan hydrobromide to the mix, you've just built Cherikov and Allergy Jr. This is so powerful because it shows you that these different boxes on the shelf, they're mostly just slight variations of the exact same core medications. It really is like a giant puzzle coming together.
But before we wrap up, we absolutely must pause to highlight the most severe warning from our source notes. There's a specific quote highlighted distinctly in the original notes. Maxtra, C/I in less than 4 years. That C/I stands for contraindicated. Maxtra is strictly, explicitly contraindicated in children under 4 years of age. Remember earlier when we talked about the 6-month rule for Cetirizine? Well, the rules for these combination syrups are even stricter. You simply cannot safely give Maxtra to a 3-year-old. No exceptions.
I want to leave you with this final, essential safety question. It really is the ultimate takeaway from the dense web of information we've unraveled today. Before you even think about the math, before you calculate weight divided by 4, ask yourself, before I prescribe Maxtra, is the patient over 4 years old? Letting these strict age guardrails guide your practice will ensure these life-saving rules stick with you long after this explainer ends. Thanks so much for joining me. Keep learning, and as always, keep asking the right questions.